Welcome back to the Victory Education Lounge. I'm your host, Maurice, and today we're diving into part 37 of our series, Medications that can induce insulin resistance. Before we begin, please like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this crucial information. While medications are often necessary for managing various health conditions, some can have unintended effects on our metabolic health, including the potential to induce insulin resistance. In this video, we'll explore several medications known to affect insulin sensitivity, discuss strategies for managing this side effect, and provide real-world examples to illustrate key points. Did you know that some medications can induce insulin resistance? This is a fact that often slips under the radar, but it's critical to our understanding of metabolic health. Insulin resistance is a condition where our body's cells become less responsive to insulin, a hormone that regulates blood sugar levels. When insulin resistance occurs, blood sugar levels can rise, potentially leading to conditions like type 2 diabetes. Certain medications, while necessary for treating various health conditions, can contribute to the development of insulin resistance. They can do this either directly, by interfering with insulin action, or indirectly, by promoting conditions that make our body less responsive to insulin. Now, you might be wondering, what can we do about it? Well, the good news is, there are various strategies to manage and mitigate this side effect. These strategies range from regular monitoring of blood sugar levels, discussing alternative medications with your healthcare provider, making lifestyle modifications, to timing medication doses strategically. Some people might find success in combining medications with insulin-sensitizing supplements, while others might benefit from regular check-ins with healthcare providers. And then there are strategies like gradual tapering of medications, where possible, and practicing stress management techniques. Each of these strategies has its pros and cons, and they may not all be suitable for everyone. But by understanding these options, we can make informed decisions about our health, in consultation with our healthcare providers. In this video, we'll be diving into each of these strategies in more detail. We'll explore how they work, their benefits and drawbacks, and provide some real-world examples to help illustrate these concepts. It's important to remember that while medication-induced insulin resistance is a significant concern, it's not an insurmountable obstacle. With the right information and resources, we can take steps to manage this side effect effectively. Now that we understand the basics, let's dive into the strategies to manage medication-induced insulin resistance. Our first strategy is regular monitoring of blood sugar levels. This allows for early detection of changes in insulin sensitivity, a crucial step in managing medication-induced insulin resistance. However, it's worth noting that this approach can be time-consuming and may require frequent, potentially uncomfortable finger pricks. Let's consider Sarah, who is 50 years old. She was able to detect her developing insulin resistance early by rigorously monitoring her blood sugar levels while on corticosteroids for her arthritis. Next, we'll discuss the possibility of discussing alternative medications with your healthcare provider. This can be a beneficial strategy as it may lead to options with less impact on insulin sensitivity. However, the downside is that alternative medications might not be as effective for the primary condition. Our friend Mark, aged 45, provides an excellent example of this strategy in action. He worked closely with his doctor to switch from a beta blocker to an ACE inhibitor for his hypertension. This switch had a positive effect on his insulin sensitivity. Remember, these strategies require proactive communication with your healthcare provider. Regular monitoring of blood sugar levels and discussing alternatives are proactive measures that can help manage medication-induced insulin resistance effectively. Stay tuned as we explore more strategies in the next scene. Next up, we have lifestyle modifications. Among the most effective strategies to counteract medication-induced insulin resistance, lifestyle modifications can significantly improve overall health and insulin sensitivity. However, it's important to note that this approach requires consistent effort and a significant time commitment. Let's consider Lisa's example. At the age of 38, Lisa was able to offset the insulin-resistant effects of her antipsychotic medication by adopting a Mediterranean diet and incorporating a regular exercise routine into her daily schedule. Moving on to our fourth strategy, timing medication doses strategically. This can be a game changer for many patients. By timing when you take your medication, you may be able to minimize its impact on your blood sugar levels. However, Remember that this strategy can be challenging to stick to, especially if you're dealing with a busy schedule or taking multiple medications. Take Tom, for instance. He's 60 and found that he could improve his glycemic control by simply taking his statins at bedtime rather than in the morning. Whether you're considering lifestyle modifications or timing your medication doses, the key takeaway here is that these strategies require dedication and consistency. Both approaches demand a proactive role in managing your health. But remember, every small change can make a significant difference in your journey towards better health. Our fifth strategy is combining medications with insulin-sensitizing supplements. This approach can help offset the insulin-resistant effects of necessary medications. For instance, Emily, a 55-year-old, worked with her doctor to safely incorporate berberine supplements while on her necessary medications. However, this strategy is not without its risks. Combining medications with supplements can lead to potential interactions. Hence, this should always be done under the supervision of a medical professional. Moving on to our sixth strategy, it entails regular check-ins with healthcare providers. This approach allows for ongoing assessment and adjustment of treatment plans. David, a 70-year-old, maintained better metabolic health through quarterly checkups with his doctor while on multiple medications. However, the downside to this strategy is that it can be time-consuming and potentially costly. In both strategies, the common thread is the involvement of healthcare professionals. Whether it's combining medications with supplements or regular check-ins, these strategies require careful management and regular medical supervision. It's crucial to remember that managing insulin resistance induced by medications is a team effort. It involves the patient, healthcare providers, and sometimes the support of loved ones. While these strategies can be effective, they are not a one-size-fits-all solution. It's important to work with a healthcare professional to identify the best approach based on your unique circumstances. These strategies require careful management and regular medical supervision. The seventh strategy is gradual tapering of medications when possible. This approach can often reduce the impact on insulin sensitivity over time. The upside here is that by slowly lessening the dose, your body has time to adjust and maintain better insulin sensitivity. However, this strategy isn't always possible depending on the condition being treated. Take Maria, for example. She's 40 and was able to work with her doctor to slowly taper off her corticosteroids, allowing her body to adjust and maintain better insulin sensitivity. Next up, let's talk about stress management techniques. These can help counteract the metabolic effects of stress-inducing medications. The pro here is quite evident. Less stress equals better overall health. But, of course, this requires ongoing effort and practice. Let's look at a real-world example. Consider John, a 55-year-old man who found that yoga and mindfulness meditation helped him manage the stress from his high-pressure job and the side effects of his necessary medications. Remember, though, that these strategies are not quick fixes. They require patience, careful planning, and a holistic approach to health. It's about finding the right balance for you. Talk to your healthcare provider about these strategies and see what might work best for your situation. Medication-induced insulin resistance can be managed, and you're not alone in this journey. These strategies require patience, careful planning, and a holistic approach to health. We've covered quite a bit today about managing medication-induced insulin resistance. Let's take a moment to wrap up the main points we discussed. Firstly, we talked about the importance of regular monitoring of blood sugar levels. This allows for early detection of changes in insulin sensitivity, although it may require frequent testing. Then we navigated the realm of discussing alternative medications with your doctor. This could potentially lead to finding options with less impact on insulin sensitivity. But remember that alternative medications might not be as effective for the primary condition. We also dove into the benefits of lifestyle modifications to counteract the effects of medications. This method can significantly improve overall health and insulin sensitivity, but it does ask for a consistent effort and time commitment. We highlighted the strategy of timing medication doses strategically, which may help minimize impact on blood sugar levels, but could be challenging to adhere to a strict schedule. Next, we discussed the combination of medications with insulin-sensitizing supplements. While this strategy may help mitigate the insulin-resistant effects of necessary medications, it's crucial to be aware of the potential for interactions, and to only pursue this under medical supervision. We also emphasize the importance of regular check-ins with healthcare providers. This allows for ongoing assessment and adjustment of treatment plans, although it can be time-consuming and potentially costly. Furthermore, we explored the idea of gradual tapering of medications when possible. This could reduce the impact on insulin sensitivity over time, but it's important to remember that this isn't always possible depending on the condition being treated. Finally, we examined the role of stress management techniques. These can help counteract the metabolic effects of stress-inducing medications, but also require ongoing effort and practice. As we continue to understand the complexities of medication-induced insulin resistance, new strategies for management emerge. For instance, some researchers are exploring the potential of insulin-sensitizing adjunct therapies to be used alongside necessary medications. It's crucial to remember that the benefits of many medications often outweigh the potential risk of insulin resistance. Never stop or change your medication regimen without consulting your healthcare provider. As we wrap up, I want to remind you that the information provided here is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Your health is unique, and what works for one person may not work for another. Thank you for joining us in the Victory Education Lounge. If you found this video helpful, please give it a thumbs up, share it with friends and family who might benefit. And don't forget to subscribe for more informative content. Until next time, this is Maurice wishing you health and vitality in your journey to understand and optimize your body's incredible systems.